Hello guys, welcome back to my channel. If you're new here, you're very welcome. My name is Bonte Xavier. Yeah, you know it guys, you're a shy girl but full of courage. That's me. If you've been here before, thank you so much for coming back to watch another video. And if you have not subscribed yet, please click the subscribe button below. Then give it a thumbs up if you like this video. If you like it more, you know what to do, please share. So today we're going to do a very sensitive topic, a very sensitive one. When I mean sensitive, it's very sensitive. Sensitive to us medical students, medical professionals out there, to the society, to the patients, to everyone. And I'm not going to do it alone. Of course, guys, you know it's a talk, and I can't wait to read your comments down below. Please, this topic is for everyone. If you have personal experiences about this topic we're going to talk about, please comment down below. Share your experiences and tell us how you go through this experience, right? So don't forget to leave a comment down below. And without further ado, let's get into the video. So you're welcome, Dr. So here is Dr. Gikunju. How are you feeling?
Nervous.
Don't be nervous. It's just a talk. It's just a chat with these people here. So today we're going to talk about. What are we going to talk about today? I'm waiting for you to say. What are we going to talk about?
We have to do this thing by the way. I don't know how.
We're going to talk about medical malpractice.
Can you reshoot your part?
No, we're not reshooting anything.
So,
what are we going to talk about? I'm going to edit out.
So we are going to talk about medical malpractices.
Yes.
Medical negligence.
Exactly. So if you don't know what medical malpractice, at the end of this video you'll have an idea. And I'm not a professional in these things. It's just I'm a student and I'm still learning, and these are just my opinions and small things I learned. So if you want to learn from me or from us, yeah, you're welcome to learn. And if you have more things to add, please leave a comment down below. And I guess you should introduce yourself.
My name is Prudence Gikunju Mereithi. I'm an ATP student studying at the Kenya School of Law. I'm here to share the legal knowledge about medical negligence. It feels happy to be on Daktari's channel. I'm glad.
Oh gosh.
Thank you.
Thank you for introducing yourself. And as you heard it guys, if you need a lawyer, you have a plug here. Anywho, so you guys just give me back my stethoscope. I feel like you're so comfortable with it. We have a lawyer and a doctor here, or a future doctor. So let's get into the video without too much stories, right? Let's start. What's medical malpractice?
Medical malpractice is doctors falling below par of the medical expectations, such that if another doctor of the same caliber is put in such a position, would do and we could get a different result as to what the former or the first doctor did. So this could cause maybe bodily harm, death.
Yeah.
So if it had been done differently by another doctor and those two instances never occurred, then that proves medical
malpractice and negligence, right?
Yes.
Yeah. So that's it. That's it, guys. I wanted to do this video for a long time, but I wanted to do it with another colleague, like a medical doctor, but I haven't been able to get any doctor to do this video. For some reason, they are all refusing because I want them to share their experiences and all those things. So, but I managed to get a lawyer, which I think it works out very good. So, first of all, medical malpractice, for it to be considered a medical malpractice, it has to constitute an act,
Yes.
a duty,
Yes.
then a breach, then
Yes.
damage, right?
Yes.
So, yeah, basically what's an act, cause you know, basically this video is all about you. It's me asking questions and letting people know, basically awareness.
So an act in this case is the patient needed to be treated, so the doctor must have done the treatment aspect part of it. Yeah.
Then duty.
It's the duty. It's basically there has to be a doctor-patient relationship or a doctor-patient-hospital relationship, because there's a person who has to carry the burden of proof of the medical malpractice.
Then breach.
So breach basically is when the person, that is the doctor or the pharmacist, goes outside the duties. So that's the breach.
The damage, basically, at the end of the day, the patient's situation or health degrades, right?
Yes.
From how it was before treatment and.
Yeah, from a legal opinion now, the damage could be death.
Yeah.
Or maybe the health of the patient has deteriorated, so a loss of an arm, or even maybe a loss of a body part. So the surgeon, the doctor, could have extracted that body part which he or she was not supposed to.
Whew. I feel like it's already getting intense. Anywho, let me give you guys an example so that we can put everything that you just said in one. A 46-year-old woman undergoes an abdominal surgery performed by her general surgeon. 4 hours post-op, she's writhing in pain, and after requesting multiple rounds of additional pain medication, the attending physician orders an X-ray which demonstrates the presence of a surgical instrument left behind in the abdomen during the procedure. The patient develops sepsis, but does ultimately recover. So here, what's the act? The act definitely is the abdominal surgery.
Yes.
So you have to have a procedure that was done, not done, omission, right? Yeah. Or negligence for it to fall under medical malpractice. Then the duty, it would be the duty is you have to have a doctor and the patient, right? So as I said, it's her general surgeon that did the procedure. That's the duty. Then the breach, it's the presence of the instrument that was found in the abdominal cavity. Sour. Then the damage, the patient ended up developing sepsis. That's damage.
Okay.
Sour.
Yeah.
I hope you guys understood that. For medical malpractice, you have to have act, duty, breach, and damage. So the next question, before we get so much into this thing, first of all, do you as a lawyer, as a member of the community, do you know your health rights?
I know my health rights. I love to quote the law as it is. We have the Constitution, we have the Article 43, whereby everybody has a right to health. And we have other documents or other legal documents that talk about it. We have the Fatal Accident Act. When it reaches to a point of prosecution, part of it, we have the Healthcare Act. There are documents that we use, people need to understand when it comes to the healthcare part of it.
Okay, so what are your rights?
My rights, my health rights, number one is I have a right to affordable healthcare. When you talk about affordable healthcare, is I can afford the system in place, mostly in government institutions. Have a right to, the doctor should not dispense my information about the sickness that I have. Okay. And the third one that I would love to put across that people don't know is you have a right of emergency treatment in any hospital that is near you. Yes.
The way you're putting it is like someone has refused giving treatment.
The reason I'm putting this is because I've come to understand people are not being, they cannot afford these private hospitals that we have, and it's an emergency treatment. So the hospital asks for, high rates, and since you cannot afford, they don't take you in. As long as it's an emergency, it should be first to be, handled in the nearest health facility. Yes.
As you said, they're all correct. So I feel like it's very important that everyone knows their health right. First of all, yes, everyone in the society deserves treatment. Whether you are poor, rich, social status, whatever your social status is, old, young, blah, 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 you deserve treatment.
There's no discrimination.
Exactly. Number 3, you have to have consent. Basically, me as a doctor, I cannot treat you without your consent. I cannot do anything to you without your consent.
But the consent.
As long as you can give consent. If there's no necessity, if you cannot give consent, you have to give.
Exactly.
You have to tell me someone that can help you give consent on your behalf.
But I need again to put this across. In emergency situations, consent has to not be given. In emergency life-saving situations.
Okay. So, and as long as doctors, you're there for the benefit of the patient, right?
Patient, yes.
Yeah. Of course, also, did you know that patients actually, they can actually refuse the treatment from a physician?
Yes, that's your right.
So it's your right.
And the same thing, doctors can refuse to treat a patient who is physically abusive to them, but on one condition, it's not an emergency treatment. So in other walk-ins and the patient is brutal or something, we can decline to treat them. Sexually,
Yeah.
harassment.
Yeah. Okay, that's a good one. Let's say I'm in my 70 years old, I'm really tired and I don't want any treatment anymore. Maybe the treatment is surgery or radiotherapy, which are actually some treatments you see the treatment, but at the end of the day, you're still going to go through a very rough road during that treatment, and I don't want to experience that. Let's say I want to just be injected insulin or some drugs that can help me just sleep peacefully and never wake up. Is there?
In Kenya, it does not allow.
It does not allow that.
So in Kenya, the only moment that life should be taken from a person is when you're defending your own life. So you should not take life in any other instances. So in such a situation, even in those patients who don't want to walk or be taken to hospitals, well, as long as a doctor can reach you, what doctors do is take care of you until your point of death. So, but they cannot assist in death.
Like palliative care.
Yes.
Do you know what palliative care is?
Yes, indeed.
Palliative care.
Yes.
So basically, palliative care is basically managing the symptoms like pain, instead of you managing the exact specific disease.
Like death.
Yeah, maybe I have cancer, but if cancer is not curable, I can just be managed for my pain, or psychological, mentally issues, such things.
That's allowed.
Yeah, okay, so that's palliative care. Then also patients have rights for privacy, to choose their own doctors.
Yes, it does happen, but you'll get notice if you go to public hospitals. You
don't have any right.
You don't have any right of choice. But if you happen to go to private hospitals, you'll choose to be attended by a male doctor, a female doctor. They'll give you a right of preference as compared to our public healthcare system. Could be because number one, private hospitals are in business, so they need to. Could be that's one of the needs. Number two, our public hospitals are understaffed. No choice of preference.
Yeah.
So in private hospitals you could get this. In public hospitals, I'm so sorry.
Denied.
I don't have a choice of preference in most instances.
And also the patient has right to ask questions. I feel like most patients, they just go in a hospital room or in the consultation room, and whatever the doctor says, that's it. It's rare to find a doctor asking the patient, do you have any question? Do you have any other concern? I feel like, patients are supposed to know their rights, that they can ask questions about their condition, and every doctor out there should be happy to answer every question.
It's your right.
It's your right to ask questions. Do you ever ask?
Anybody who knows me, I'm inquisitive. I'll always ask questions, but what I've noticed in public hospitals, because of the high number of patient-doctor ratio that we have in this country, one doctor having to treat a lot of patients, they may not have that time so that you can keep asking all these questions. Number two is you find that the doctors and the patients, they may not have this relationship in terms of language and the education background. Most of the doctors nowadays they're very young, and as compared to when we used to grow up. So this old Kikuyu man, this old Meriam man already has downgraded this young girl, this young man who is going to treat him in hospital. So it could be also part of the reason.
Everyone can become a patient. Everyone, this body is just, at the end of the day it deteriorates. At the end of the day we are going to end up in the grave. Sorry to say it, but sad fact, that's how it is. So most doctors forget that they can also be patients. So the way you want to be treated is how you treat other people. If you have any other right you think every person should know, what process should I do, or how can I lodge a complaint?
Number one, I would like to put this across. We have professional bodies that doctors, dentists, and pharmacists that are part of. I've seen people claim they are going for compensation from these bodies. These bodies don't give compensation. What they do is a peer review. For you to be compensated, you have to involve our courts. But again, these bodies can nowadays they're encouraging instead of going through the court process and the entire process of the court. Their act or charter allows for arbitration or mediation, so that certain scores can be settled without going to the court systems. So an example, if a doctor has done or a surgeon has done a surgery and my hand, which should not have been chopped off, but the treatment was made my hand to be chopped off. What the professional bodies will do is to recommend either the doctor to be struck off or the doctor to go for retraining, or the revoke of the license. That is done by the Kenya Medical Practitioners and Dentist Union, KMPDU. But now for me to get the compensation, I have to involve the court system. So the court system is one that's going to give me the compensation. And again, encourage people. There are so many decided cases in our country now. I think we can also review them. Okay, number one, we must understand there has to be a doctor-patient relationship and a doctor-patient hospital relationship. So I start with the second one, doctor-patient hospital. The hospital which has employed the doctor needs to understand that there was during the treatment process, part of it, something went wrong, which I feel had it been done by another doctor, there should have been a positive outcome. So the patient can start by lodging this from the hospital, but then can upscale this to the KMPDU. So where am I going to the KMPDU? As a citizen, I have a right of, it's my right to protect other citizens from undergoing the same process that I have undergone through. That's the reason I'm reporting this specific doctor to the KMPDU. So when after I'm finished with that, or even in the process, because at times these things may take a little bit longer. And
like how long?
They take even 3 years. Some could take 6 months, 12 months. So as this continues, I can go and lodge the same in a court of law, because I'll need to claim, my leg being, you say cut off, or amputated. Yes, if my leg is amputated, it could lead to loss of a source of income, because could be nilikuwa a conductor, a matatu conductor, and so
you need your leg.
I need my leg so that I can reason my job. So that's why we go for claims. We should involve a court of law. We have.
And is it free? It will cost me money?
Going to the Kenya Medical Practitioners and Dentist Union, it will not cost you money. That one is free, because it's a duty they should dispense. But going to a court of law will cost you money.
Okay.
Yes.
Where do the patients first of all lodge a complaint? Do they want the doctor to be punished? What do they want exactly?
One.
Do they want an apology, Amma?
One, you see, a doctor who is a professional and has done something which has cost you life, because you're talking about death or loss of a body organ. So number one, that's a doctor who is not fit to be in the profession. Sorry to say. So number one, I'm fulfilling a Kenyan citizen duty. Number two, it could have led to a source of income.
Okay.
Number three, emotional, there's an emotional loss. You will put it that way. So that's the reason patients will rush to courts and these unions. But again, as I said, unions are for peer review. If you need to get compensation, work in courts.
And basically, from the examples you have been giving very serious examples, amputating the arm, amputating this, and would you think also just small things, like for example, I'm a patient somewhere, right, waiting for the doctor. The doctor is supposed to be in the office, but I'm somewhere drinking tea, my breakfast. Basically, the patient is waiting for me. Do you think that's malpractice?
It's malpractice in as much as we see it in not in a small. You see it's in small magnitude. Let me give an example. There was a case
to the end of this part 1. Please stay tuned for part 2, and I hope you have been following up with this medical malpractice series. So do not forget to subscribe and turn on the notification bell in order to get notified when I post a new video. See you in the next video. Bye. Do not forget to leave your comment about medical malpractice if you have ever had to face medical malpractice. See ya.